Dear colleagues, let me introduce our report about the prevalence of smoking in the population of Krasnoyarsk, it's my city, according to the big data of the epidemiology of cardiovascular disease and their risk factors in the region of Russian Federation study, and of course, and possible ways of modifying these risk factors. If you know, unfortunately, Russian Federation occupies one of the leading positions among countries with a high-frequency smoking population. We know about the risk of stroke in smokers, for example, is 1.5 times higher than no smokers. Tobacco additional significantly shortens duration lives of the population. It's estimated that smoking men aged from 35 to 74 years on average live less by 70.7 years. And we ask about reduction on these factors in the population can significantly reduce cardiovascular mortality and other diseases. So quitting smoking leads to 50% reduction in cardiovascular disease mortality, while constant administration of antihypertensive drugs, for example, only by 25 to 35%. In this slide, you can see strategies of managing risk factor. The first is risk avoidance, implying refusal to perform action that carry risk. The second, risk acceptance, is the strategy. The risk is recognized, of course, but no action is taken. The third is risk sharing. When choosing such strategy, the risk is either transferred to the other party or shared with it. The typical example of such strategy is insurance. And the last is risk reduction. It involves taking measures and reduce the risk up to the complete elimination. The measures taken either reduce the probability of negative event or reduce or severity of its consequences, or both on the same time. What is the slide? Harm reduction strategy. What is the strategy? Is used is medicine and, of course, social sphere in order to minimize of harm, which person or society are exposed as a result of dangerous actions or any behavior, and which cannot be completely excluded or prevented. If you see sunscreen, seat belts, speed limits, and helmets in our life. How can tobacco harm reduction be achieved? The first, tobacco and nicotine-containing products exist of continuum of risk. Some are more harmful than others. Cigarettes and other combustible tobacco products are considered the most harmful. The goal of tobacco harm reduction is to reduce smoking-related health risk among adults who don't quite by offered them low risk. Non-combustible alternatives. While not risk-free, not-combustible alternatives reduce exposure to harmful and potentially harmful constituents compared with cigarettes. And tobacco harm reduction strategies are complementary to current tobacco control policies, and they are not aimed at circumventing approaches to preventing smoking initiation. Purpose of our study is conduct of sub-analysis on the multi-center of study ESSE-RF Russian Federation in our city Krasnoyarsk, and study the prevalence of smoking among the adult population of Krasnoyarsk. Materials and methods of our investigation in 4 clinics in the city of Krasnoyarsk, 1,000 patients aged from 25 to 64 were examined. Persons we considered smokers if they smoked at least 1 cigarette per day. According to the patients, the smoking status smoking now, the second quiet smoking, and next smokers. And the intensity of smoking were determined. Low up to cigarettes, 10 cigarettes per day, moderate from 10 to 20 cigarettes per day, and high smokers more than 20 cigarettes per day. In the slide, you can see comparative characteristics of smokers and non-smokers depending on the sex, age, and blood and pressure level. In the first group, smokers, men 161 and women 107, systolic blood pressure 168 and 190, it's normal. And group 2, non-smokers, third and fourth group, 48 and 607 women, systolic blood pressure 135 and 124. And next you can see significant level between age, systolic and diastolic blood pressure. In the slide illustrated distribution of examined by smoking status, total population, you can see never smoked, 55%, and 21 left of smoking, and 23 smoke. And for men and for women, it's very different. This is smoking prevalence adjusted for age and sex. You can see red blocks, 47%. From 35 or 44 years in men and 20 for women in this group. Conclusion in our study: the prevalence of smoking among the adult population of Krasnoyarsk is very high, is 23%. Population of our city approximately 1 million people. Among men, if you see smoking rates and higher than among women, approximately 40% versus 15%. We identified patterns, actualized the need to introduce deeper measures aimed at preventing smoking in Krasnoyarsk. An alternative is now modify these risk factors and use electronic tobacco heating systems manufactured by Philip Morris to reduce the content of harmful substances and cancerogens. And now I want to talk about what can I do. Smoking is the main modifiable risk factor of NSD. Nicotine also not harmless, if you know, and is now a main problem. Smoking cessation should become an essential component of NSD prevention and, of course, treatment. For those patients who don't want quit smoking, it's advisable to consider using the harm reduction concept. It's necessary to simplify the possibility for patients to receive information, and it's necessary to adapt regulation for clinical regulation in proportion to the harm caused. Thank you so much. Please, your questions.